Could a simple blood procedure be the most proactive health decision you've ever made? Today on this episode, we invited Angela Howey, a registered nurse that works at one of the MDLifespan clinics. She's going to reveal and walk us through step by step what it's really like to go through a therapeutic plasma exchange procedure, aka TPE, and why this procedure is completely changing the way that we think about detox and disease prevention. Let's dive in. Angela, it's great to have you here. How are you doing today?
I'm great, Joe. It's great to be here.
Yeah, and I'm excited specifically to chat with you, selfishly a little bit, because I'm going to be doing TPE, Therapeutic Plasma Exchange, pretty soon, maybe at the Detroit office where you're at. But you're a nurse that's hands-on doing this stuff every day. So
Yes, I
it's
am.
pretty, is it pretty exciting? I mean, like it's your daily thing, but like, I mean, this is a kind of a newer thing, right? For you as well.
Yeah, it is really new for me. My background in nursing is well, I've been a nurse for about 20 years, so I've done a lot of things.
Mhm.
And I have a background in vascular access, which is pretty much just poking people.
Well, that's important though, right? To get it right for this.
And it's my Jedi skill. I'm a little good at it, but I actually found this position. Was a little serendipitous. I uh, kind of stalked LinkedIn for, future positions, always looking for opportunity. And I saw this position for apheresis specialist. It called for all of my qualifications, and I was like, well, let's do it. And a whole new world opened to me with plasma exchange and functional medicine, precision medicine.
Interesting. So you didn't have the background in it, but obviously you have the skills and what's absolutely necessary for uh, the poke, more or less,
Yeah.
to do it right. Because there's definitely, obviously, important there, and we'll talk about that. Because
Yeah.
like we were pre-chatting, selfishly, I'll ask you some questions of someone who will be going through TPE very soon. Uh, but yeah, like so you found, I guess what has opened your eyes? Like what's and you can maybe tell a little bit of your background where it's relevant here, but like what are some big ahas now that you're doing these therapeutic plasma exchanges, what, daily?
So I went from just, regular a med-surg nurse into hospice, and then which was wonderful. I mean, I really do still have a hospice heart. Um, then my cousin actually was diagnosed with breast cancer, and we sat down, we went over all of her plan, and I knew nothing. I knew nothing about oncology. So I decided to become an oncology nurse. So
Uh-huh.
I went into oncology, and I'm a nurse, so usually we have two jobs. So I was doing vascular access on the side and oncology full time.
Mm.
And I went back to school to become a nurse practitioner. And the whole through line through all of those is that we don't really do anything to prevent people from getting ill. We treat we treat people when they're already ill. And the big thing that opened for me, like when I got into this position with plasma exchange, is that we have an opportunity to help people before they get ill,
Yeah.
to either delay their symptoms or prevent chronic illness altogether. So I am actually re-energized in nurse practitioner school because I'm like, instead of just writing prescriptions for people because with their chronic illness, we have a way to actually help them.
Because I mean, yeah, you as a nurse, you're in the front line where
Mhm.
not a lot of people are communicating with patients to the depth that you probably are, right?
Yeah, it's primary care is like the whole idea of primary care is to help people like to stay well, to have a relationship with them, but our primary care practice is broken in our country. It's very rare. Like if you're a healthy individual, and I'm just saying healthy, generally healthy,
Yeah.
you go to see your primary care physician once a year, maybe
Mhm.
twice a year. You get your labs. If they're good, that's fine. Um, it's hard to get back in to your primary care doctor if you just have a basic illness. Most people go to an urgent care because it's quicker. And I feel like during the plasma exchange, obviously we have people like we're captive for a couple of hours.
That's
So
true.
we can really talk about like their symptoms and, what they're focusing on as far as toxin avoidance.
Yeah, it's interesting because this is a whole different aspect of care. It's this
Hmm.
personalized
Hmm.
medicine. And you mentioned prevention. So, and yeah, the healthcare system definitely does not seem set up for preventing things. It's more aiding or going after the symptoms after something's already popped up, right?
That's correct.
I guess and you're re-energized. So like what aspects are you seeing? And maybe it's like with some patient stories, anything you can like, are there some trends or things that you're seeing now that you're kind of in the driver's seat that are different from what you've seen in the past?
Well, I've seen people who, like my very first patient that I did here in Detroit, she was pretty much ready to retire and give up her career because she is so fatigued and tired. She's gone through all kinds of treatment with immunoglobulins, and she just really has like chronic inflammation and some autoimmune disorders. But she's done 3 TPE sessions, and she said to me, even after the first one, she's like, I'm not really sure if I could tell you that I have more energy, but I
Mm,
can tell you that I've said yes to more things and I've took on more projects, whereas she was before ready to retire. And
wow.
that's super, I mean, that's huge to me because it, if a person can, feel energized to keep going instead of just hanging up, their hat, I
Yeah.
mean, that's huge.
I mean, that's like a whole new refresh of someone who, because I mean, are there trends like in the ages that you're seeing of, the type of people in there and maybe some of these turnarounds like that?
Well, it's interesting. I've been to the Chicago clinic and the Detroit clinic. I haven't been to the Orlando one, but I talk to the nurse Mitch there all the time.
Hmm.
And he seems to see like older populations. I seem to see middle-aged populations like myself,
Hmm.
and there's some younger patients in the Chicago clinic. So the younger set seem to be either they're having autoimmune symptoms, like inflammation symptoms, and they want to get rid of them, or they want to prevent that. They've gotten their toxin test and they're like, no, we're just going to go through this exchange and get rid of that, which actually happens to be the boat I'm in because I had my toxin test
Yeah.
and I need to go have a plasma exchange. That's what I've decided.
Me too.
I know.
Well, is that typically, and of course, like we talked about the test, and Dr. Savage has been
Yeah.
on here multiple
Mhm.
times talking about know your own data. Is that something that you walk people through? Like, are you a part of that conversation at all with folks?
Not usually. I'm usually seeing the patients after they've already talked to our physicians and they've settled on a plan and they're ready to go. So then
Got it.
after they, I see them when they're in the chair, just, before we talk and have conversations about what to expect.
Yeah, that makes
So,
sense. Well, how about like on in terms of because now you're likely getting, prior to your in your nursing life, you weren't thinking probably as much about toxins, but like now, and I'm thinking of like what are some of the most common maybe illness trends or toxin related symptoms that you're seeing that maybe folks listening or watching might be like, oh, interesting, like sounds familiar.
probably fatigue.
That's a big one.
Yeah. Looking back, I've had fatigue for a while myself, and there's different things that you can do, but that's something I think is more related to toxins in our body than I ever knew before. So
Mm,
that's part of the eye-opening process for me. And I feel that the patients I've seen, that is the hugest or the biggest symptom that they have, sorry, is fatigue, and they want to get rid of that so they can function and take care of their kids, grandkids.
I'm at 40, and I feel like I don't know if that's the younger of the TPE group or if that's the middle. I don't even know what I call myself, but like I'm thinking of fatigue because I'm like, yeah, I feel a little tired. I have two little ones at home, have my own business, things like this, managing things. Obviously, this podcast is part of it too. Like, are there common, I guess, signs of fatigue that you would rank as like, oh, that's something worth exploring a little further?
Yeah, there's a normal fatigue that you have, like running after little ones, being busy with your
Yeah.
career, you want to stay healthy. But if you're finding yourself just like at the end of the day or 4 o'clock, 5 o'clock, just I can't function anymore. I need to just take a nap. Like you're literally hitting a door and
Mm.
you can't even move, or you aren't able to like get up and take care of yourself. Those are like serious like signs of fatigue. That isn't the normal. I'm tired. I've been running all day.
Yeah, yeah, that's true. It is a different feeling.
I think people should pay attention to those signs more. It isn't really I think I thought for myself, like, I'm just getting older, this is just a
Hmm.
part of getting older. And I think it's just a part of being overloaded with toxins. Like, we don't know how good we actually can feel because we're so used to kind of feeling like crap for a while.
I think that's a pretty common thing that I see here in these chats, but also just, I mean, just chatting with my own friends and
Hmm.
family is, yeah, everybody has their own thing or different lifestyles, but we're all exposed to toxins, right? So,
Yeah.
uh, and until we really know, do the test for ourselves and understand our data, like I know I have a bunch of mold in me. I'm like, didn't know that before. And
Right.
didn't think I would be. I'm in a hot place, but um, you don't know until you actually see your own data, right? And then you can kind of map a little bit more of that to maybe a symptom you're feeling.
You can say there's so many toxins to avoid in the whole world, and when you start looking into it, like I have in the past year, it can be overwhelming.
Hmm.
And that's what I try to talk to patients about is just making small changes, every day. Just pick one area to make a change in, and then once you have that down, like make another change.
Hmm.
Like, and when you get your toxin test, you can see what you really actually need to focus on. Like, I have a really high level of BPA in my blood. So I was not even thinking of BPA as being like, I thought that would not be what would be in my system.
Sure.
So now I'm really going to hone in and focus on how do I not expose myself to BPA and
Hmm.
plastics in the future.
Yeah, which it's so hard, right? With the world of like literally everything seems to be wrapped in plastic, and it's like, why
Yeah.
does that even need to be there? Like,
Yeah.
why are you wrapping an apple in plastic for? Stop
Right.
it. But yeah, but we lifestyle choice is a even, after TPE, of course, is very important. I guess, yeah,
Yes.
what are your thoughts on that too? Because like, of course, you can clear the slate through TPE and get rid of a ton of toxins, but there's still the changes after the fact.
Yeah, I think in analogies, so I kind of think of it like your toxin load is like a bucket. So once you go through TPE, then your bucket is pretty empty of toxins. So then you want to just kind of keep it as low as possible.
Yeah.
But every now and then you're going to have a rainfall of toxins, and then the things that you can do to like scoop out so your bucket's not full.
Mm.
The biggest thing is just to avoid them. So, well, I'm ridiculous. I didn't even wash my vegetables until I got this position. I mean, I rinsed them, but I
Yeah.
wasn't like, I'm just like a little dirt, never hurt. Like,
Uh-huh.
I'm like a typical nurse. Well, you're either a germaphobe as a nurse or you're just like, whatever, I'm not dying. And I was the whatever, I'm not dying kind of a nurse.
Yeah, yeah.
Now I'm like using vinegar and soaking my vegetables in fruit.
All right, that's what I was gonna ask. Like, what's your protocol? So it's vinegar, and so like literally walk me through. Like, you get a bunch of vegetables from the store.
Yeah,
Um,
you get like your vegetables. I definitely peel my cucumbers. I used to leave some of it on for the nutrients, but now
mhm,
I peel them. Grapes, I kind of used to just rinse under the water and not soak them. So now I soak them in like vinegar and water.
mm.
Um, and like lettuce, I have like a vinegar water spray that I spray and then rinse and then pat dry.
Hey, You laugh, but it's like these are all things that are like I'm not doing that.
I know. Yeah, that was me. I mean, I would probably eat even some dirty grapes, like, because I just thought it was dirt. But I've read studies even about like spinach and all of the heavy metals that are
Mm.
like just on a spinach leaf. And I'm like, oh man, I'm so dumb.
Yeah. I mean, well, you're not dumb, but it's but I mean, I think all of us can probably say guilty,
Yeah, very guilty. Yeah.
and you don't know what you're like if you're going eating out, I guess you're hoping for the best.
Yeah.
You're not gonna
Yeah.
bring a little spray bottle with you everywhere, but maybe.
Yeah. Yeah, I think I don't drink out of plastic containers anymore. I love coffee and I really struggle with not using my Keurig. So
Oh
because
yeah,
it's so fast, but it's so bad. So I
because
have
the
a
plastic
single,
cups, right? Yeah.
yeah.
What do you go for coffee then instead?
Well, if I was real good, I would do the pour over and grind my own beans, but I'm not that great. I'm still opting for a little bit of speed. So I have a
Yeah.
single use coffee maker that I just have my
Yeah.
pre-ground ground beans and go. But it's
Gotcha.
like an aluminum or stainless steel basket. So
That's better. Yeah. I do something similar with the espresso machine, but like, yeah, pour overs are great, but like, what do you always have 15 minutes in the morning or whatever it is to do
I
it
do
all?
not.
Yeah, most people don't. But well, no, cool insights, and that was a little diversion from what I was thinking.
Yeah,
That's good.
sorry.
It's all good. What do you think? Like now that you're in this whole, I mean, you're working with MD Lifespan, and you're literally getting patients coming to you because they know they're toxic. And there's toxins in them. Is there any like misinterpretation of detoxing, or like is there a different frame that you give people or an understanding of, I guess, what that means and how to do it? Because TPE is part of it, of course.
A lot of people that I've seen so far are really knowledgeable about toxins and they want, to detox and they're serious about the lifestyle modifications that they'll need to do to keep their toxin load down.
Yeah.
I think if I've seen anything, it would be that you can just do plasma exchange and you're good to go, and then you can go back to your lifestyle and you'll be fine. But I haven't seen that too much. Really, what I've seen are people who understand that detox isn't just like a liver cleanse or something that you can drink, or it really is modifying your lifestyle to avoid toxins, your toxin exposure, knowing that you're not gonna avoid toxins altogether.
Yeah, they're not going away at all in the world.
No, no.
Seems like there's a lot more popping up. So, and we've had a lot of episodes. We probably won't go into it in depth here because I have some other ideas. But yeah, definitely for listeners, watchers, go watch some previous episodes with Dr. Savage and I mean almost everybody else talking about like how what things to avoid. Air, water, just inside the house, like cleaners and things like that. Right.
Yeah, Dr. Savage has some great recommendations for air filter. That was also another thing that I did once I got this job is got an air filter for my home and water filter. I was just drinking the dirty Detroit water from the city, not filtering it.
Risky.
I mean, I live on the wild side.
But that's most people, right? Like you just don't know. And yeah, I know there's ways to actually look up your area code or your zip code and see like the kind of stuff that's floating around in your city water, county water, and it's pretty eye-opening. We have someone coming on pretty soon to talk more about that.
Oh, that's great.
But,
Yeah, it
yeah.
really is eye-opening to start pay attention to that. Yeah.
Yeah. So when it comes to TPE, because I want to walk through kind of like some of I guess the experience that someone has when they go through a procedure. Of course, selfishly, I want to kind of know what I'm in for too.
Yeah.
But like before that, if someone's listening, watching, and they're just kind of understanding what TPE is, like, could you, I guess, describe it in a way that's almost empowering? Because I know some of it could be a little bit overwhelming or a big commitment, but like, I guess how would you frame it to someone who's just kind of learning about it from a nurse who's literally doing it daily for patients?
I think of the concept, and Dr. Savage just says it like an oil change. I really think it's empowering because, and this is how I talk to people. It is a procedure. It's not a small procedure. You're not going in for surgery, but it is a procedure, and some people are quite concerned about it, like rightfully so. I think if you come into having a plasma exchange, knowing that it is a procedure and you have to take it seriously, that's great. It's not just like going to a med spa and getting hooked up to an IV. That's not it. But it is an empowering thing that you can do to proactively change your life. Like you might not feel the effects from it. You might not feel any different, even after 3 or 5 exchanges, but you will be rid of all of those toxins. And depending if you have no symptoms, then then that might happen. You might not feel any different. Most people feel a little bit different, like they have more energy or less fatigue, but you're doing something proactively that you might not even know for the next 5 years. Like you might have these toxins in your body and you might not feel any symptoms for 5 years or so, but by the time you have a symptom and you go to your doctor to treat the symptom, like damage is already done and might not be reversible. You just have to take a medication for that, for whatever chronic disease you have.
Got it. So basically going to the source early, right?
Yeah, that's how I think of it. And if you do have symptoms and you already have like an autoimmune disorder or some other kind of uh, chronic inflammatory disease, you this is one of the best things that you can do outside of just taking treatment for whatever it is. Like to change your weight because you're actually like resetting your immune system so your immune system can function properly. Like our bodies are, diseases of aging, like my age, happen because of chronic inflammation and it just creeps up on you. You don't even really see it. And this is just kind of a way to reset your body to do the things that it's normally supposed to do. Like our bodies are amazing. They're wonderful. I mean, we all have superpower of healing within us. We're just overloaded, like kind of like our immune systems are kind of like a crane that has too much weight on it. It can't function and it breaks down. So plasma exchange is like getting rid of that load so your body can go in, fix your immune system, and then you're good to go and you can carry the regular immune load that you're supposed to carry.
It's a good analogy with the crane too, because like, yeah, we are taking on so much even without knowing, but like we talked about just the toxin load and burden that we're all carrying already, but then just our lifestyles, right? Like in stress, inflammation. I mean, like you said, that's the source of basically everything, right? Like all the disease.
It really does boil down to that, the chronic inflammation of our life.
Yeah. Yeah. And getting to the cellular level where you can clean that out and actually have that function properly again,
Yeah.
from the ground up. Well, how about let's I'm your patient. Hey, let's just do this because and maybe you'll actually help me. I don't know if I'll go to Detroit or not for my TPE, but I'm thinking it's almost like my brain logically is like, okay, what do I got to know before I go? I'm signed up. I know I've done my toxin test. If anybody's curious, you can go see it. We did a whole episode on it. So that's where I'm at right now. So like, what's the stuff beforehand I should be kind of preparing myself for? Um, and then want to get into like the during and then kind of the after. And for
Okay.
me, I have 5 sessions that Dr. Savage recommended. I've heard it's what, 3 to 5 typically for folks.
Right, correct. It's typically 3 to 5. Number one, you can go to any of our locations and our nurses are going to be amazing. So
Yeah.
you will be taken care of. So beforehand, you really just have to prepare yourself for the day. So if you're going to fly into one of the locations, just prepare yourself that you're going to be tired like that night of, probably the next day. You should probably not drive. Like I have patients that drive to me, so I typically recommend don't drive until you know how you're going to feel. Some people feel great and they can drive afterwards, but the first one, we really want you to just take care of yourself and not drive because you could be really fatigued afterwards. And I
Yeah.
would expect that. I would tell you, you're going to be real tired, kind of like you have the flu, achy. So don't plan to do anything, like don't run a marathon the next day. That's what I would tell you.
Yeah, yeah. Okay.
So plan it out. Like you're going to need a day or two to recover.
And are you seeing most people traveling in for the procedures?
It's like half and half. Yeah.
Half and half. Yeah. So this, I mean, this is applicable to most people, for me especially, but because I'd be flying in and essentially flying back out
Yeah.
fairly quickly, but I wouldn't be
Yeah.
driving, so that's
Right.
good.
After this whole journey, what I really learned here is like there are a lot of health conscious people. I think I'm considering myself one as well. But no, there's a lot of things. No matter what you do, how much you pay attention to it, how much you avoid it, and sometimes it just got in. And I think TPE gave me a good opportunity to restart my body again.
Is there any prep, like, let's say before I hop on the plane, or like, you know, is it like a week before or just days before I go into an office?
Like the day before, we don't want you to eat anything real fatty because if you have like lipids in your blood system, it could affect the exchange. Just there's sensors on there that can, if you have like a fatty meal the day before or that the morning of, like it'll affect the exchange. So we really just want you to like eat a normal healthy meal, meals the day before, but the morning of, which is really hard for a lot of people because there's people who are fasting or just don't eat breakfast the morning of. We want you to eat a good meal, good protein, like some carbs. And when I think of a hearty meal, I don't know why, but potatoes always like pop up.
Yeah.
So yeah, eat a good meal the morning of. That just helps prevent like low blood sugar during the process, with hypotension afterwards.
Yeah, and I've read that as well, as like just go in full, right? So you're not fasting during this whole thing. You said not a lot of fatty stuff, but get good protein, some carbs, and
Yes.
yeah, it's essentially satiate yourself in a way where you're not gonna, you know, because it's gonna be a procedure, right, for a handful of hours. So
Yes. Yeah.
got it.
Now, the other thing is we don't want you to hydrate the morning of. Like, don't get up and drink a ton of water. We want you to stop drinking an hour before you come in to your procedure because you're in the chair for a couple of hours. So having to get up and go to the bathroom is not an option.
Yeah, I've heard of that where I think it was Dr. Ed Lee he was telling me about one of his patients, and
Yeah.
yeah, they had to cut it short because one of the patients had to use the restroom. So
We do have urinals and bedpans, but nobody wants to do that.
right. Point is just, yeah, cut off the hydration hour-ish before. Okay, that's
Yeah.
fair. Well, how about this? So like, Angela, I walk through the office, I greet you, or you greet me. Like, I guess, what does that look like? What's the day look like once I get there?
Well, once you get here, I'll ask you if you have to go to the bathroom, then get your height and weight and your vital signs, let you get comfortable. People usually bring a phone or um,
hmm
like earphones. You can talk to me the whole time. I'm totally fine with that. Some people don't like to converse, so they just listen to podcast or anything like the book on tape.
hmm
So then I will scan your arms with an ultrasound to look at your veins. I want like the best vein possible. So we'll start 2 IVs, one in each arm. So one is the return IV, and that's like a smaller IV. And then the other one is a little bit larger gauge of an IV because that's the one we're going to pull the blood from that will go into the machine and separate your plasma.
Gotcha. Okay. So basically lounged out in a chair, two arms out. Yeah.
Yeah.
Two different IVs. I like the ultrasound concept because
Yeah.
it helps you, but also helps, the patient not to do a miss or so.
That it really is helpful because we want to make sure that we're not putting the IV access up against a valve. We want to make sure that we're far enough away from any bifurcations in your veins. We just want to make it the best stick possible.
So how about this? So what's the duration? And I guess like what would people be? Yeah, everybody experiences this differently, and obviously everybody has a different relationship with needles too. I guess what's your best practices like for someone to hang out? Like, I guess what is that experience once they're hooked up?
So once you're hooked up, then you have a job to do. You're not done. You have to squeeze a ball to keep that vein open. It can be really tiring to like just squeeze a ball for 2 hours. Most people, it's about an average 2 hours actually hooked up to the machine. It could be a little bit longer depending on how much plasma we're going to remove. So we test when we start the IV, we'll test your blood for your hematocrit level. So that really the hematocrit and your height and weight kind of help us figure out how much we're going to pull off of you, how much plasma we're going to exchange.
What's the hematocrit level? What is that?
The hematocrit is how many packed red blood cells you have in your blood. So
Got it. Okay.
yeah.
So the more you have, would it be a little? I guess how would
So the
you
lower your
determine?
hematocrit, the more plasma you have, essentially.
Got
Yeah.
it.
Mhm.
Okay. So you might take more out
Yes.
from someone if that's the case.
Yes. Yeah. If they have a real low hematocrit, we don't take out like as much because that is, could be dangerous, but or
Hmm.
not, I shouldn't say dangerous, but we don't want to have anybody like have low blood pressure. So
Got it. Yeah.
so once you're hooked up to the machine, and you're pumping your arm, you'll start to notice like right away that the plasma separates from the blood, and you can see your plasma like fill up a little bag,
Hmm.
and then your blood starts circulating back into your system with the other IV. And then as they separate, we're also giving you a replacement fluid, 5% human albumin, which is a similar color to your actual plasma. But every couple of minutes, we load another like vial of the albumin. And if everything goes great, that's fine. But usually we have problems with some alarms because the pressure in your intake is down. So I'm monitoring the pressure of your vein, the veins
Mhm.
and the intake. And then your job is just to keep pumping. It's a little harder than it sounds because if you're
Yeah.
watching something or you're talking to me, you can get distracted and not pump. So
Right. Yeah. It's literally a team sport right now.
it
Everybody got to
is.
work together.
Yeah. Yeah.
And so yeah, that's 2 hours. So you're kind of yeah, I'm sure hopefully getting in the zone,
Mhm.
and maybe people need to do those I forget those group strength exercises before they end up going. Maybe that's a prep. Um,
Yeah, you could do that as prep. You could start getting yourself a little squeeze ball so you get your
right.
forearm used to it.
Grip strength, I heard it's good for your long or it's a determinant. I don't know how true that is, but
I
maybe.
just heard that as well. So on my drive to work, I have a little grip strength
Dude,
ball.
there you go. See? Maybe I don't know the research behind it, but I've heard it quite a bit.
I don't think it
But
could hurt, you know.
yeah. Yeah. Well, it can't hurt you.
Yeah.
So during the fact, so it's about 2+ hours in the chair. Uh, Anything else going on that I guess it's that process, right? The whole time it
Mhm.
sounds like. Okay, until you're complete.
Yeah, and it seems like a lot. Sometimes it goes faster than others, depending on, how fast we can run the machine, which really is determined by a person's vein and where we can get access. So that's what we monitor. We monitor the pressure on the machine, and then also we're monitoring you to make sure that you're doing okay. Typical symptoms that we see, thing that we use calcium citrate to prevent clotting in the machine. most of it is taken out with the plasma, but some of it gets back into your blood and then binds with your calcium in your bloodstream. So we can see signs of hypocalcemia, which is really just like tingling around your like nose or your mouth. It's this real funny light feeling. We do replace calcium proactively. Most of our patients don't have any symptoms whatsoever. If they do, we give them a little extra calcium with the albumin or a Tums if they need it, but most people do fine. Some people get a little hypoglycemic, and we know that because they start yawning like mid exchange. They just start these big yawns, and then they're like, no, I'm fine. And we're like, drink this juice.
Yeah, I would trust you.
Yeah.
I've seen a lot of folks. But that's great. And that's I think it's good to know for everybody here and me. You're in good hands. Not only are they, you're looking at the machines, but you're looking at the person too, and just checking in throughout the whole thing. Good. So I guess what happens, unless there's anything I'm missing during, but like, let's say right after, like when it's wrapping up, that first session, or maybe it's the third session even, what's going to go?
Depending on your hematocrit, sometimes there's like only ever 160 milliliters of blood out at a time. So it's not like we're a bunch of vampires and we're draining all of your blood and putting it back in. So even if something were to happen and we had to like turn the machine down, I can't even think of what would happen, but just if there was an emergency, there's only 150 or 160 milliliters of your blood out, which is not that much. So depending on your hematocrit, if you have a high hematocrit, we're not going to give you that 160 milliliters back. If it's under like 45%, we'll give it back to you. That takes a few minutes, but we can take that large IV out at that time, and then you just have one IV in. And then depending on your protocol that you're getting, we'll give you IV infusions afterwards.
Gotcha.
So then you're just kind of hanging out with the IV. You can move your arm, you can get up and go to the bathroom, eat, anything like that. So
nice. Okay. So everyone has a different protocol, and there's a lot of information on MDLifespan about this as well. Different guidebooks to go check out.
Yeah.
But so that sounds like that would be like a separate, I don't know, is that infusion typically, or is it a mixture of other things?
Yeah, there are different infusions.
That's the awesome thing. It's, the physician's going to talk to you about that, and based off of who you are. So it's legitimately personalized to whatever your goals are, right?
Yes. Yeah.
I like that part. It's not a one size fits all kind of thing, right?
Yeah, it is. It's pretty incredible actually, but yeah.
So what happens so you might be fatigued afterwards, someone goes, you go home, however you get there, ideally not driving. What's happening? There's like a month gap, right, between sessions?
Yeah, so right afterwards, you will probably feel tired. Sometimes people kind of have a reaction, depending on how many toxins and how many bad autoimmune complexes they have in their body. They might have what we call a Herx-like reaction, where they're kind of tired and achy, almost flu-like for a day afterwards. So like that day or two, depending on the person, you might have like aches and pains, like you feel like you have the flu. But most people like really like the second day after, like the day after, real tired. The second day after, they're better. So a lot of people during that 4 weeks just go back to their normal self. Some people I've heard they feel real great, and then they notice when the toxins start coming back in, because your circulatory system is kind of like a roller coaster. And so the toxins are just kind of lined up, ready to get on board. And so we do the exchange, and they go through and they go off, and then there's more ready to come on. So around that 3-4 week, the toxins are kind of back in your circulatory system. So some people have said they start feeling like, oh yeah, I need the second one because I'm really starting to feel fatigued again.
I mean, that goes back to Dr. Savage's analogy of the oil change, right? It's
yes.
like,
Yeah.
you do the oil change like to an old car, and
Right.
you drive it around for a while, and then it's bringing out the gunk again, right?
Yeah. Yeah.
Time to clear it out. So, and you said anything else between the sessions that you recommend folks to do?
Well, most people have a like sign on for a plasma exchange protocol, and with that comes our MDL clean supplement, and that actually has a lot of the nutrients that is going to help your body like rebuild all of the good things for your immune system. So we really recommend everybody doing that consistently every day. Some people can only do a little bit, and some people do it a lot, but the more consistent you are with it, like 7 days a week, the healthier you're going to feel, the better you're going to feel, and the more your body's going to be able to regenerate those good things that your immune system can do.
Nice. Okay. Cool. Yeah, and I know those are all dependent on the protocol. You'll have
Yeah.
different things.
Yeah. And I talk to people and find out what obviously they're focused on, because usually everybody has something specific they're focused on. Like for you, it would be molds. So I would talk to you about like, where do you think the molds are coming from, and like in your house. You're like, I have coffee molds that are found in coffee, and I'm like, oh, that's right on board for me because I drink a lot of coffee. But
I mean, that might be me too. I have a cup next to me. I haven't finished it,
yeah.
but yeah. And I've heard, molds can be in a lot of coffees too. That's an issue. So,
Yeah, yeah. So that's where your toxin test will really kind of tell you like what you need to focus on. So I just discuss it with each person, and then we kind of pick something to focus on like in their like life, just to modify their life to avoid those toxins or help reduce exposure to it.
yeah, I mean, you can't totally prevent it, like you said,
Right.
these days, unfortunately, but it's good that now you know the data from before, and yeah, you
Yeah.
can kind of work through your goals and what you can kind of control. And then then you get into round two, round three,
Yeah.
and is it kind of more the same, or are there any differences in feelings or expectations in the future sessions?
Usually people tolerate the subsequent sessions better because the first one you're getting rid of like 60% plus of the toxins that are in your body. So you're
Wow.
going to feel more tired that first one. Usually people tolerate that second and third one better. And they have more energy. And then from a nursing perspective and like lifestyle modifications, we just talk about how they've been doing, what they've been doing differently, and what they want to focus on.
Yeah.
And then
This,
and of course the different protocols, depending on your protocol, we do different infusions after each one. So that could be different, like depending on what protocol you have and which infusions we're giving.
yeah. So it really comes, and that's what I love about this is know your data, sync up with the physician, and really you get so much more of an understanding of what's happening in your body, but also like what you can do about it now. And I think that's the big change, right?
It really is empowering because you're essentially preventing yourself or doing the best that you can outside of like diet and exercise, right? Like those are things that we know. And
Hmm.
it's also, a lot of people we're not great at, but it gives you more incentive because exercise actually like helps you also detox your body.
Yeah, for
And
sure.
the food you eat can help you detox your body. So those are wonderful things to like help focus on.
Nice. Yeah. I think, is there anything that maybe I should have asked you with as a patient, trying to get my head around the experience and, what to expect?
I think we went over most of everything. The poking, some people really have an issue with the needles. We try to do the best that we can to make it as painless as possible. Of course, when you're
Yeah.
getting poked with a needle, it's going to hurt a little, but we have some pain relief measures that we try, and we really focus on like breathing and try to like have some distraction. But if a patient does have real needle phobias, like letting us know that so we can prepare for that and help them through that is really key.
Yeah, and I know everyone's different, but yeah, like I love breath work, so that's definitely what I'll employ. Is,
Yeah,
you know,
yeah.
maybe load up some tracks from YouTube or some apps, you know, and
Yes,
uh,
yeah.
have you heard of any recommended soundtracks that people like?
Oh my gosh. We just had a patient in Chicago and she told us we need to come up with our own like TPE like
Totally.
playlist. So I think that we're taking suggestions. But
Okay.
she had like, the Rocky song.
Okay, pump up.
Yeah, there's a couple of those uh empowering songs like that she recommended.
That's good. Yes. I mean, that's 100% like come prepared with a playlist or whatever it
Yeah.
is that makes you feel great, right? Well, this is awesome. I mean, Angela, it's helped me honestly be a little bit more comfortable going into it.
Yeah.
And yeah, I mean, this is like the deepest dive I've experienced with the actual experience so far. Of course, I'll report when I do mine. But yeah, what were you gonna say?
Oh, I was just gonna say, yeah, because you have the idea of the plasma exchange and you have all of those intellectual like things about it. You know it's good, but then to actually do the actual procedure, it's a different thing. And actually, when I got this position, I actually went and donated plasma because I wanted to see what it was like being hooked up to the machine. And
Hmm.
even just donating plasma, I was a little nervous about it because it's a big needle. It's a little bit scary because they talk about, different, things that could happen.
Yeah.
And it actually think it helps me be a better nurse because I know what it's like to be hooked up to the machine. Now,
Yeah.
plasma donation is not an exchange. I was not hooked up for 2 hours, but
But
still,
similar needles and
yeah,
yeah, that's
yeah,
good to know. I mean, for people who have donated plasma, and it's just to kind of frame that timing differently, like the duration. But
yeah,
got it. Okay,
yeah.
cool.
Mhm.
Well, I mean, this has helped me a ton, and I I hope I go visit you in Detroit. So I gotta get my
Well, I told you
yeah.
it's the nicest one.
But to your point, though, yeah, the nurses at MDLifespan, I know there's like some really cool training
Yeah.
that keeps everybody looped in on the latest, right? Like,
We're all vascular access trained nurses, so we know how to use the ultrasound and start IVs, and we are really big nerds about your veins. So just be warned, if you have good veins, we might nerd out about it a little bit. But I think all of our nurses are great and wonderful humans, very caring.
I've definitely had some bad ones where you're just like, ooh, I don't know if you should be around needles doing that. So, but I know, yeah, MD Lifespan, I mean, everybody on the team is like super particular and,
Yeah.
very knowledgeable. So
Mhm.
that's good. Well, Angela, this has been super helpful for me. I hope it helps everybody else too, kind of just getting
Yes,
more of a
me too.
picture.
All
Yeah.
right.
So,
Mhm.
go check out MD Lifespan, of course, and check out a location. But I would urge you to check out those guidebooks too, because there's a lot of cool information there on the
Yeah.
protocols and really understanding a little bit more. And get that
Mhm.
toxin test
Yes,
too.
the toxin test is amazing.
Yeah. All right, Angela. Well, appreciate your time. Thank
Thanks,
you.
Joe.
Uh-huh.